Good evening, everyone. Um, I hope you're all well. So, before we proceed, I would like to request you all to kindly post in the live chat if you're audible. I hope my voice is clear. Before Dr. Shoeb joins us, I'm going to request you all to help me. Good evening, everyone. I hope you're all. I'm going to request you all to please post in the live chat if I'm audible. Hi, Hasina. Hi, Vasanti. Good evening to you all. Hello, everyone. Good evening. Before we proceed, I'm going to request you all to please continue to, verify that you're audible on the chat. So once I sort of get a clarity on that, Dr. Shoaib will be joining us shortly. All right. Hi, Priyamvada. All right. I'm glad that we are audible. Please give us another minute. Dr. Shoaib will be joining us. Good evening, doctor. I hope I'm audible. Also going to request our viewers on YouTube to also just verify that you're audible. As doctor, you're on mute. I'm just going to request you to unmute.
I'll unmute.
Yes, doctor.
I think it's unmute. Actually, what happened? I purchased this new phone just a few days back, and I forgot to install the Zoom app in that somehow. So those COVID days, all
Thank you
that we made it by Zoom, but unfortunately, just realized that I don't have an important discussion. Is the voice clear?
Thank you for joining us in such a short. Yes, doctor. Yes, you're audible. I hope I'm also audible.
Yeah. Yes, as usual.
You're live, doctor, anyway. So before we proceed, just like to welcome everyone. Good evening to you all. We have patients watching this live. We have caregivers. We have their parents, their families, and also just well-wishers of such patients, and also those who like to learn more about who are science nerds, But so before we proceed, one of the most common manifestations of lupus is in other than the skin is in the kidney, and usually sometimes it might come with very obvious symptoms, but most of the times it comes in a very it comes in disguise in a very sly, silent way. A simple example would be when I didn't even know I had nephritis until my rheumatologist, Dr. Shenoy, just said, let's do a 24-hour proteinuria test. And this is a sort of story that you will hear with many patients. While many patients do show symptoms like swelling, etc., that's one of the tricky aspects of lupus nephritis. And in 2017, when I was getting my first renal biopsy, I met Dr. Shoeb, and it was and it was a pleasant meet because at that point I was very scared of hospitals and doctors, didn't know how to communicate with them. Of course, things are a lot different at the moment, but and that's how I connected with Dr. Shoeb, and doctor is now a consultant nephrologist and transplant physician in Hyderabad Care Hospitals, Banjara Hills. And and I've always been following doctor's videos and content online, and we stayed in touch. And it's such an honor to have you joining us, doctor. Thank you very much.
Yeah, thanks. So I hope you remember that day. That was a night actually. That was my first year in nephrology, and you had a long list. In there's some app. Just some friend is a doctor, right? She made that very nice history altogether. It made my job so easy actually.
Yes, shout out to Dr. Prasanna. He's the one who made that for me.
He's the one. Hats off to him. Yeah.
Yes, doctor. So, doctor, if we could just proceed, like you said, we'll keep this a very, what do you say, an interactive question answer session.
Yes.
Yes, doctor. Doctor, could you just tell us what does nephritis even mean? A lot of times these medical jargons can really scare the living daylights out of us patients. And how does
exactly.
Over to you, doctor.
Yeah, nephritis basically these are all medical jargons, as you have told. They are like quite complicating. Any ITS means there is some inflammation. That's what is the basic meaning of its. Is, for example, you have thrombophlebitis. There is some inflammation there, or you have something called any its is a inflammation or some sort of just to make it more simple, it is some sort of war going on between two things. That's inflammation, or some sort of an aggression between the host, that is the body. Body is trying to fight out something which it thinks is foreign. It doesn't belong to the body. So that's what is happening. So when these things happen in the brain, it is called cerebritis. When this thing happens in the heart, it is called myocarditis. Similar thing, if this thing happens in the kidney, it is called nephritis. By definition, cerebrum is, or cerebellum, whatever, these are all parts of the brain, and myocardium is heart, and nephron is the kidney. From there, the word comes, nephron and itis, they both go together. There is some sort of inflammation, some sort of a fight going on inside the kidney. And this fight can be of various categories. It can be routine street gruel, somebody's shouting and all. So in such things, or it can be a street fight, or it can be a really gun warfare. It can be anything. So that's what nephritis is. And that's how it's classified. The severity of nephritis depends on how the kidney really reacts to it. So we'll discuss that shortly. But just to describe more about the fight, what happens is kidney has many structures inside that. I'll get a paper 1 second. You guys can see this?
Yes, doctor, we can.
Yeah. So basically, this is the shape of a kidney. It's a very beautiful bean-shaped organ. So if there is any fight going on, it becomes reddish in color and there is some sort of a fight. For example, if a mosquito bites your hand, a small sort of a reddish spot will come over there. You may even scratch over there. Similarly, if this disease called lupus or many other bacteria that can cause inflammation inside the kidney, if such things happen, then the kidney also becomes reddish in color and it starts leaking protein and blood cells. That is the only way kidney can react. And third thing, the way it can react is it can react like a turtle. It can just go inside its, that shell and hide. So it shuts down. So that is represented by the rising creatinine. So these are the only three ways a kidney can react. And that's the level of nephritis which can happen. Yeah, I think that's more simple.
Absolutely, doctor. I think that
Yeah.
really helped visualize it. So, doctor, the next question would be so about 60% of lupus patients end up having some form of nephritis. Now, out of which only a very small percentage, end up unfortunately having to see renal failure. But could you tell
Yeah.
us how do you diagnose it and what are the symptoms? And even in the case of diagnosis as well, like there are a lot of like patients are very overwhelmed with the fact that okay, there are a lot of blood tests for lupus in itself. Now, are there going to be new
Yeah.
tests? How does it help? What are the correlations, etc.?
Yeah, basically, it's quite a big. Maybe we can talk the whole night on this topic itself. That why very few people, or most of the people, or whatever it is, they develop lupus nephritis. Lupus per se, as we at present, whatever science knows about lupus, is that it is some sort of a war with the body, with its own people. So that's what is happening inside the body. So lupus means that body is trying to fight out whatever is inside the body. So what happens is body sometimes tries to tell, I don't need the brain. It can cause lupus cerebritis. Body sometimes tells, I don't need this part of the skin. It may cause some sort of a rash. Body may think, I don't need these joints, and there may be some inflammation and joint pains happening over there. Or body may think, I don't need this skin inside my mouth, and so it's in some sort of a anarchy is happening inside the body, and some sort of things are happening. So we really don't know why the kidney gets involved in lupus, but one thing for sure is kidney filters 180 liters of blood in 24 hours. So kidney is the very basis of maintaining the sanctity and cleanliness of the body, and in that filtration it also filters a lot of proteins, something called immunoglobulins, which it is supposed to resist and supposed to go. But when you have aggressive immunoglobulins coming, or you have aggressive neutrophils, these are all names of the army which the body has. Like our country has, army, air force, navy, rapid action forces, some black cats, and all those things. Raw. Similarly, body has many sort of things: lymphocytes, neutrophils, eosinophils, and all a lot of things. So whatever body maintains. So these things sometimes they come and get stuck to the filter of the kidney. So the filter is supposed to be like a slit-like thing, and through these holes, water or urine is supposed to come out, and protein is supposed to get repelled. It is not supposed to leak from these tiny holes which the kidney has. This is called the filter of the kidney, or glomerular filtration, which happens at the nephron. Nephron is again the big part of a kidney. So these filters, which are resisting these antibodies to stay in the blood, suddenly they start, like when they come in excess, they can crash onto the filter. There is a basement membrane. They may get stuck on it, or they may just slow down and
Doctor, I just request you to unmute. I think you went on mute. I'm just gonna request doctor to unmute. Doctor, I hope I'm audible. Just request you to unmute. Yes, doctor, we can see you now. Yes.
Yeah, sorry. Actually, I had a really urgent call about a transplantation. So what we was talking is, you was talking how the nephritis really happens. So just to understand, so what we were talking is, nephritis is like the blood which is having a lot of these antibodies, or a lot of high immunity. Basically, lupus is also a state when you have a lot of immunity, a lot of power, which is supposed to be used for many other good things, but unfortunately they are like tricked into hurting their own self to a certain extent. So these things get stuck into the kidney's basement membrane, or kidney's basic filter, and they start damaging it. And that's how nephritis happens. This roughly, as the data tells, this is not my data, what international data tells is, in the past 100 years, whatever we know, is that around 40% of patients with lupus, at the time of diagnosis, they have lupus nephritis. And in the entire course of their life, what they tell is lupus is very active at the mostly in females, and secondly in the reproductive age group, roughly between like 10 years to 50 years. We can just make a round figure. So this is when the estrogens levels, the hormones in females are slightly on the higher side. They may end up in causing more severity of lupus. So in the entire course of the active lupus phase, 60% of the people develop lupus nephritis. So this is the data, but they may not be true. I know many nephrologists, including my boss, Dr. Unni, who is India's 32nd nephrologist out of like whatever nephrologist came in India. From Professor Chuk, my boss is the 32nd, 32. So that's the order of hierarchy. He believes that lupus, 100% patients have kidney involvement. And he has justification to that. He tells that need not be that these antibodies come and start damaging. Sometimes they're just sitting over there, and that itself is lupus nephritis. If you are having a terrorist sitting in your neighborhood, you itself is at a high risk. So that's what he used to tell that, and that's what class 1 lupus is. If you tell class 1 lupus nephritis, that's what it is. You don't really biopsy somebody or take a kidney piece out and see why lupus hai kya isme. When you remove it, incidentally, you may find there is some lupus features. Then that features is nothing but this immunoglobulins getting deposited over there. So lupus nephritis, what I also believe, like my boss, is that 100% of patients with lupus or SLE eventually have some involvement inside the kidney, just by the virtue that it filters so much blood every day. So how do you diagnose, as you just pointed out, that lupus nephritis ko diagnose kaisa karte hain, and when do you really suspect that this particular person has got some lupus involvement? It's very simple. जैसा मैं अभी बताया आपको कि kidney, is it okay to talk in Hindi?
Yes, doctor. We can do a blended. We can do Hindi and
Yeah, it's more. I'm comfortable with English actually, but whatever it is, हकीकत निकल ही जाती है कभी ना कभी. तो कितना भी so so what happens is the kidney can react only in a very limited fashion. So kidney is not like, it can do something unique. The only thing it can do is, as I told you, it can start leaking blood, it can start leaking protein, and third thing, it can stop working. That's when the creatinine goes up. As a result of these things, BP may go high. You may develop some swelling in the legs because you're not producing enough urine, or the albumin in the blood is coming low. Such complications may happen, but essentially only three features through which you can think that the kidney is involved. blood in the urine. With a complete urine examination, it's a basic test which we can really find out. If you have RBCs more than 5, you may think that there is hematuria. It may not be like red urine aa raha hai pura ekdam hi, pura blood aa raha hai, tabhi we'll think that kidney is involved. It may be very microscopic microhematuria. Second, protein. Clinically, you may develop frothing of urine. Urine becomes soap-like or detergent-like. So that's one. And if you check your 24-hour, as you told, you have done it in the past, 24-hour urine, you may detect a lot of protein is coming. In
Sorry, doctor, I think you've gone on mute. Doctor, I'm going to request you to unmute. Yes. Yes,
Hello?
doctor, you were telling us
Yeah,
about
yeah,
proteinuria.
yeah. If you lose protein more than 500 milligram in 24 hours, that's quite a significant number, and such a person definitely has some sort of involvement in the kidney, which may require some serious therapy for quite a long time. That's what I mean by serious, not like the serious ICU serious. And creatinine may go up if kidney stops working. These are the only 3 ways a kidney can react. Yeah.
Right, doctor. Okay, so these are the 3 parameters as you mentioned. Doctor, is biopsy actually necessary? Now, the reason I'm asking you is this is because even I remember when Dr. Shenoy told me, okay, now that we are seeing a high amount of proteinuria, and I was probably 16, and he said, let's do a biopsy. And of course, I was petrified with the fact that, okay, some sort of a long needle is going to be what do you say, poking me in a part that I don't even know, and it's going to take something out of my kidney. That didn't feel very assuring, right? Of course, and I went
Mhm.
on to do it multiple times, and now I'm pretty comfortable with it. But a lot of times, patients are like, "Do you really need to do it? Is it absolutely necessary?
Yeah.
Could you
Where
tell
all
us
did
if
you
it's
get it multiple
necessary?"
times? Or was it Aster only multiple times? I don't know. I saw you once
No,
only.
I got it in R&R Delhi, Research and Referral
Okay.
Delhi. Yes,
Okay. Okay. But the experience in Aster must have been the best because of me, is it?
of course, having you was,
Okay.
yeah.
Very nice. Yeah. Huh? No, no, it's
Yes,
fine.
doctor.
Yeah. So basically, biopsy, I have patients who have, asked me if we tell biopsy, Doctor Saab, cancer to nahi hai mere ko. Such things they start thinking. And biopsy
Exactly.
is a word which is very, in our society, biopsy has been associated with cancer big time. So on a daily
Exactly.
basis, we tell patients biopsy because not only for lupus, many other reasons. Because kidney is such an organ which I know uh, if you look at from outside, you can just see the shape and structure that, you may just see, this guy has a head, but whether there is a brain or not, we really don't know. You have to open and see. That is the only way. So in kidney, there is no test that we can see what is happening inside unless we really take it out. And as you have told, multiple biopsy doesn't make a difference because in one kidney, there are around 10 lakh small holes, like the small hole that is called glomerulus. That is a filtration. What happens is if you take out a piece that is just around 10 to 15 glomeruli, maximum 20. So that doesn't make a difference. It's just like what I tell patients is, your kidney ka piece nikalna is like taking 1 or 2 hairs out of your head. What difference it creates to you? Nothing, no? So don't worry, nothing is going to happen. But obviously, it is not as that simple. Technically, it may sound to the kidney that simple, but
Mm.
for a medical practitioner, and for a patient, it's very challenging. For a medical practitioner, the challenge is that the patient has to lie down on the abdomen for quite a long time and with proficiency in the ultrasound. And if the person does it himself, that's what we do, it's quite easy. But in some centers who biopsy is not happening very commonly, probably the doctor over there, nowadays even rheumatologist does biopsies. So it's not a big deal. So it's just a test. So if you're doing, I think at least 15 biopsies or 10 biopsies a month, getting it done with such a doctor will be a really pleasant experience. It won't be difficult from the medical point of view. And there is a very less chance of having any complication. The challenge is initially when like 2017 and all, when we did the biopsy, probably those days we used to tell, those days were not very far, 5 years back only. So we used to tell patients to lie down on the back like this flat for the next 24 hours. You're not supposed to move
Right.
and all those things. We
Yes.
used to admit one day before, discharge the next day. It was a 3-day process. But today in my practice, what we are doing is in the morning, 8 o'clock, we are doing a biopsy, and patak say night 8 o'clock, you're discharged, 12 hours admission. So it's become quite easy, and the
Right.
complication
Yes.
rates are quite less. So there is nothing to fear at all about a biopsy. Biopsy gives a whole lot of knowledge about what's happening inside the kidney, because जैसा मैं अभी बताया, ये सब कुछ is happening at a very micro cellular level, which we probably can't even measure it very properly. So all these antibodies, immunoglobulins, all this fight what is happening, they get stuck inside the kidney. So these stuck immunoglobulins or antibodies or complement levels, which are like the police force of the body, yeah, we need to really find out how much they are and how much immunity we have to suppress. Immunity suppression is good for the lupus point of view, but it may be very detrimental for the infection.
Doctor, I think you went on mute.
What's really happening, so that we can plan the long-term treatment. And that seeing happens by a special test called immunofluorescence, IF. So what we normally do is we take two strands of the hair out. Similarly, we take two small cores of the kidney. There is around 10 glomeruli. So like I told you, 20 small holes out of the 10 lakh holes will not make much of a difference. And biopsy is quite safe. Hardly there is any complication. Yeah, nothing to fear about a biopsy, and it is not cancer at all. It just gives you more idea that where you are standing, and it gives you sufficient knowledge about where you will be landing, in what flight you have boarded, and how will the flight be. Will there be a lot of turbulence, or how smooth it can be? All those things that biopsy gives you, and that's what happens. Yeah.
Right, doctor. Speaking of post biopsy, I remember we got the reports, and there were two things that was confusing. One, and I fortunately was with the nephrologist there, and that was cleared. But I often see patients royally messing these two things up. So they often think that, oh, I have class 5 nephritis, which means stage 5, and my life is ending. And
Yeah.
they do not know the difference between what class is, what chronicity is, and it's absolutely fair that they do not know, but that can create a lot of panic and a lot of fear. So if you could just slightly help us out with that, doctor.
Yeah, as you told, as you have rightly told, uh, I would like to just re-mention this point that right now we are having this informal discussion for the sake of the patients, obviously. So this is not for you to really understand and start thinking and taking some actions about it. This is just for your knowledge. That's all.
Yeah.
So that you can ask the right questions to your doctor. See, decisions regarding treatment goes as a partnership. It can't be that I am dictating terms and patient is simply taking, because these are all long-term treatments. So this requires a joint understanding and trust and joint decision making, so that we can travel a long path. So this all knowledge, biopsy में मेरे को क्या आ गया, what happened में class 5 है, class 4 है, class 3 है, A है, B है, and all those A by C है. There are so many classifications into all these things. No need to really mess your mind up about all those things, and nothing to worry about it. But what I really tell patients is you should know the disease in detail and not take actions. Ask the right questions. Understand it. Ask the right questions to your doctor who is treating you. That say, doctor, like, do we have better options, or did we miss something in a biopsy? Sometimes the biopsy specimen may not be sufficient. Maybe only one glomeruli or one small that hole is found, or sometimes such things you can ask the doctor. Probably that's what we have to do, rather than taking action and going to depression. So forget the treatment point of view and forget the outcome. You should understand the mechanism and try to understand what can be done and come with some creative ideas. Most of the medicines which we are using today in health industry have been instigated by a patient itself, because they have asked, can we do like that, can we do like this? And doctors are stuck in some sort of a, straight sort of a box. We don't think out of the box. We are inside it. हम ऐसा पढ़ाया है, हमें ऐसे ही करना है, ये है. But patients have that free will, so they give their ideas. So it's important patients understand and ask the doctor the right thing. Probably that's important from these. Regarding the biopsy classes, class 5 aa gaya, it is not cancer class 5. No, class 5 in cancer means death. That's fine. That's okay. But this is lupus. It just has some sort of a classification which tells you that your disease is behaving like this. It requires this treatment. It does not tell you your disease is so bad that you're going to die. So it
So
does not.
class does not equal to
It's not
stage,
synonymous.
right,
Yeah,
doctor?
no, class is not equal to stage. There is no way. Class is not equal to stage. Class is not equal to stage. Definitely. The stage of lupus, there is nothing called stage of lupus. Class of lupus is because, just you're in a flight, you have a business class, you have an economy class. So, so something like that. So little, if you're in a bigger class, probably you require a bigger treatment. That's all. You're in an expensive business class means you require a really expensive treatment also sometimes. So that's what it means.
Right, that's such a nice way of putting it. Not, thanks, doctor. Yeah, but can you also tell us what does chronicity mean, doctor? Just what does
Yeah.
chronicity mean exactly?
Yeah, chronicity means that the something is permanent and something has been happening from a long term. That's what chronicity means. Something from a long time happening and something which is significantly permanent. That's what chronicity means by the word itself in nephrology. So in lupus, if you find this chronicity index going up or if it's very less, so the understanding is that if it's very less means lupus is fairly well controlled. It has not going on from a long time, and the damage which it can cause is not permanent. If chronicity goes up, the more it goes up, it means that the lupus has been active from quite a long time, and it has been involving the kidney with a significant amount of mark on it. It is just like a love bite which a lupus can give to the kidney. That's what chronicity is. It may go after some time. Who knows? Yeah. Yeah.
Got it. Okay, doctor.
Yeah.
Okay,
Yeah. Yeah.
when we put up this poll that you would be doing this session with us, one of the most commonly asked questions was, what is the difference between class 3, 4, and 5? Now, I understand, doctor, it could be extremely technical. So, in just simple layman's terms, could you just sort of, like you put it with a lot of analogies, if you could just tell us and our viewers what's the
Yeah.
difference?
Yeah. Yeah. Basically, classes. What happens is, let me just come back to our thing. Yes, everything, all these classes revolve around our the glomerulus. Okay, glomerulus in the histology. When we look into the histology, means when we look at the tissue in the microscope, it looks like a hole, like a round thing through which the blood is being filtered through multiple things. So what happens is in the class 1, nothing is wrong over here. Only the packing material is having some sort of immune deposits.
Okay.
Immune deposits, what we just discussed is that excess amount of immunity which is being formed is getting stuck inside the kidney. That's what is happening. So in class 2, like this, there are many holes. Okay, 1, 2, 3, 4, 5, 6. So in class 2, it's very focal. So you may start developing some sort of involvement inside the cell also, inside the vessel. And in class 3, it involves a bit more number of, it's very simple. Huh? There's nothing logical or nothing like that. It's just very simple how this real definition came into the place. So you have something wrong in the packing material around that hole. And then second thing is you are having involvement inside the vessel, inside the hole, and more number of these small nets, these filters getting involved. It becomes less than 50% is focal. That's around 3. When we go to 4, it means diffuse, like almost more than 50% of this, probably all get involved by these antibodies or these immunoglobulins. They come start getting deposited over there. And eventually in class 5, what happens is, since there is antibodies outside, antibodies inside, the filter itself becomes very big. filter becomes very, very big. The size increases. The size increases to slightly bigger. It becomes a bigger hole. So you have a lot of protein going. Lot of protein going. That's called nephrotic or membranous. Membranous means membrane. Us means there is holes in the membrane. A lot of holes are created. A lot of protein is leaked.
Right.
That's what happens. The problem in class 4, which is supposed to be, as class 5 is much milder than class 4. What the problem with class 4 is the holes have not yet been created. So you have excess rain happening and you have water stuck behind the dam, but the doors are not yet open. So the only thing that may happen is the area behind may get flooded. That's what happens in class 4. And that's what a crescent is also. You have this extra dams made, blood is not able to get filtered, and there is a crescent. Crescent is something like a moon-shaped organ, like a dam, which is stopping the blood to get filtered out. And all that protein blood stays back. And that's what happens in class 4. And people may start developing rising of creatinine, the function becomes less, the body may get flooded by water, you may develop pulmonary edema, BP may go up. All such situations may happen in class 4. Class 3 is nothing but a transition into class 4. It's like, rain is happening and everyone is very happy, rain is happening, but everyone knows that this may become a storm in the coming days. That's what the forecast people are telling. नहीं भाई झूठ बोल रहे हैं, ऐसा कुछ भी नहीं होता, ऐसा कुछ भी नहीं है, हो सकता है. That's what class 3 is. And many people have burned their hands when not treating class 3 very aggressively. So class 3 is also treated like class 4. Class 4 ko to we have to give really high-end medicines through which we can suppress the immunity and control lupus. Class 5, we are quite safe. What happens is the door of the dams have been opened, so the chance of flooding is less. So you are a bit more careful and you have some more time to treat that. So that's what I think lupus in stages or lupus in classes 3, 4, and 5 means in this analogy. You can remember like that, a river with a dam and flood behind. So probably that's what it is.
That makes a lot of sense, doctor. Like I personally didn't know the difference as much now. This is really helpful. So doctor, now we'll sort of move to the treatment aspect. I remember post my biopsy, only thing my parents were told is just come to the hospital immediately. that itself we knew something isn't right, and that's when I remember them. I remember I think Dr. Uni and team telling me that the good news is the chronicity is less, but the disease activity is extremely high. It was 4/5. 4/5. So that's when I was introduced to there's something called cyclophosphamide.
The activity and chronicity next. Oh yeah, okay.
Yes, doctor. So now, like this is a question you will see because lupus predominantly affects women, and also women are highly concerned about. I think everyone is, but now since we're talking about women, fertility is a big concern. Is cyclophosphamide so important? Isn't there any other way to go about it? That's a question that they often ask.
Yeah. See, basically, yes, cyclophosphamide is definitely an important drug. Before we go to cyclophosphamide, I think it's time to just discuss about what can be done about lupus. So what happens is in SLE, as we just understood the basic idea that the immunity is high. And the body is having a lot of extra immunity or extra warriors, extra army people, extra police people who have no job. So they are hitting down the normal people inside the body. So the idea is to suppress these things. So medicines are targeted to reduce the immunity. If you stop recruiting police people, if you start recruiting army people, in due course of time, what happens is the army personnel and the police personnel will come down. That's what's going to happen. So most drugs work in that sort of a fashion. That's what steroids do. That's what your MMF or mycophenolate or Cellcept, whatever brand people use nowadays, that's what it does. It starts suppressing the immunity by stopping recruitment of these army personnel or things. But what is most important here is there are certain drugs which are supposed to eliminate this extra conmen in the army who are attacking the body. So you're getting it, right? That's what I mean. So there are certain people, extra army got recruited, extra police got recruited, and these guys have become unloyal to the body, and they want to destroy the body itself. So in such situation, if you give drugs, which is going to tell ki bhai stop recruiting army and police and let these guys phase off, then that's not a good idea. So you need really drugs who can eliminate these con men or unloyal people. As you all know, unloyalty or disloyalty is not acceptable at all. उसकी सजा मौत है. तो बॉडी में जो अनलॉयल स्टफ है इसको निकालने के लिए the most important drug is cyclophosphamide. That's what it does. It's toxic. It's going to kill these disloyal people down. It's going to hunt them down. So in the same process, अब guerrilla warfare हो रहा है body में, तो such some damage may happen to your own body also. The war field may get damaged to a certain extent. So those complications happens with cyclophosphamide, especially the very hot bed where all these things can happen. So you have gonadal toxicity. So pregnancy may be an issue. Sometimes you may start developing blood cancers. That's what they tell later on in life. Or you may start developing hemorrhagic cystitis, or the bladder wall may get affected and blood may start coming in urine. Such situations may happen, but they're very rare. At least more than 500 patients I have seen personally in Hyderabad is quite common. Lupus, you're also aware, the rheumatology is very active over here. We have given cyclophosphamide to many people, and our experience tells that there is very less complication, and that is the best drug available as of now by experience wise and by logic wise also. It is going to eliminate these unloyal people out. So so that's good enough. By that time, the other drugs which are going to start suppressing or stop recruitment of this extra police and army is going to work. So they both work.
Doctor, I'm going to request you to unmute.
Yeah. So I think that's what cyclophosphamide does, and that's the very important drug, and it's a cornerstone of lupus, especially when you have very bad lupus, something very severe enough, causing class 4 with crescents, lot of activity, and such situations. I think that's very important, and that is going to prevent chronicity to happen. So if you start going in the thing that I need safer drugs, I need to be very safe, let me go very slow, you may lose the battle. You may start developing chronicity.
Right, doctor.
Cyclophosphamide is very crucial.
Yes, doctor. But I think this is something that patients will feel very hopeful about, is that the fact that if the disease is not that active, I'm sure the doctor, like in my case, the first 2 years, I think, the first 1 year, I was given rituximab, or I was just given a high dose of tacrolimus with combination of MMF. So until and unless the doctor is sort of pushed to an extent where he or she has to give you cyclophosphamide, it is not something they usually do, right, doctor? If I'm right, that is.
Yeah, true. Yeah, true. That's what it is. But my understanding is that cyclophosphamide is very important. You need to push for that if you have a very severe lupus. Probably that's important.
Right, doctor.
I think so. The other drugs work by reducing the immunity in a long-term fashion, by not eliminating the bad guys, by stopping to recruit new people in. So automatically these bad guys get phased off. So that's what they do. They don't really come and stop them or eliminate them. The CNIs like tacrolimus and all these drugs, what they do is they prevent these antibodies to come and act. They are there, but they can't execute the plan, and you wait for them to phase off. That's what it does. It does not stop the recruitment. Yeah.
So, doctor, since you only have around 12 minutes left, I'm
Oh,
going to
time is going so fast, yeah. Oh my God.
I think it's interesting. It's so nice. There are a lot of chats happening in the YouTube live, which will come to towards the end of the last.
Really?
But I'm going to introduce one of our patient leaders. His name is Naveen, and Naveen's story is very interesting and also very heartbreaking, because he was diagnosed straight away with renal failure, and of course he underwent dialysis for an year, and then God's grace, he got a transplant done, and he's doing, touch wood, really well.
Oh, fantastic.
But so if there's anyone who can talk about the CKD aspect of it, and the dialysis aspect, it would be no one better than him. So I'm just going to request him to come. Naveen, I'm going to request you to keep it a little short, and also I think we'll not try to scare our patients here, but we'll also sort of give them a little idea of what could happen and how it's actually handleable. So over to you.
Hey, hi doctor, can you hear me?
Yes, you're audible.
Yeah, first of all, thank you, Achus, for introducing me. Doctor, I have a couple of questions. First question is very simple. It's about
Yeah.
managing CKD with diet and the importance of salt intake. That's that's a very important question. I wanted you to sort of talk about it.
Yeah. Salt is the essence of life. As you know, what happens is if you don't have salt, then the life is very tough. Something called hyponatremia may happen. So what happens is salt is important, but that doesn't mean that anything important in excess, it can be dangerous. So if you take a lot of salt, what may happen is BP may go high, volume, I mean, body's water status may start increasing, and you may develop water in your lungs. And high salt itself is potentially damaging to heart and liver and kidney and multiple other things are there. So probably patients who are having a kidney problem and they are like having any stage of CKD, probably from CKD stage 2 onwards, salt intake should come down to around 3 grams per day. 3 grams per day अगर मैं बोलूंगा तो normal people you can't start buying a weighing machine and start weighing 1 gram हो गया 2 gram हो गया. So it's like just like one pinch. If you take a pinch, not a like piece of salt, but if you take a pinch, that's supposed to be roughly a gram or maybe less than that. So 3 pinches of salt per day is what is recommended for all of us. But unfortunately in India the average salt intake is around 12 to 15 grams per day. That's quite high. So it's very difficult for us to go down to that 3 grams. But what my boss Dr. Udni used to tell is that whatever who is cooking in your house, mom, sister, wife, or Kamali, just tell them 50% of the salt. अगर आप ग्रेवी में 4 spoons salt डालते हैं, put 2, and that will suffice. Probably that's a practical solution. Take less salt, but take some salt. If you don't take salt, you're going to really suffer. I mean, that's what it is. Salt is good. Anything good in excess is dangerous. Anything not there also is very dangerous.
Yeah, Naveen, you'll have to unmute for the next question.
Yeah, thank you so much, Doctor, for answering this. So without taking much time, I would like to ask my second and last question. So it basically
secondly last हो गया है ये क्या है यार एकदम fast हो जाए यार come on यार.
So a lot of my questions are based on CKD stage 4, stage 5 because I was diagnosed with kidney failure, right? So I just wanted to keep it more relevant by asking a question which is sort of more relatable to a lot of other CKD patients who are at CKD 3, 3A, 3B. Yeah. So assuming if someone has a lupus nephritis class 3+5, okay, and they have a chronicity of around 6, right? Less than 5, let's say less than 5. And they have a CKD 3A, 3B, right? Which is kind of moderate. Okay. So in that case, how do you go about it? How do you go about with the treatment? Because what I was told was a lot of drugs are very toxic and they sort of act as a catalyst in, decaying the kidney. So in that case, how do you go about with the treatment to make sure that there's a fine balance?
Yeah. See, what basically, I mean, just for the general people who really don't know what really CKD is, just as we just what just asked about chronicity. So chronicity means something which is happening from a long time. So chronic in kidney disease means more than 3 months. So you're having some problem of the chronic kidney. So you have a kidney problem happening for more than 3 months. And it's a disease. Disease is generally in this, it's treatable, but in this situation, CKD is a non-treatable entity and it is supposed to be progressive in nature. So you have various stages of CKD. Probably for our audience, relevant is stage 5. From the worst, I'll start. Stage 5 is you're having a GFR. The normal GFR is of both the kidneys together is, just to take it very easy, supposed to be more than 100, just to remember like this. So less than 15, you have stage 5. 15 to 30, you have stage 4. And 30 and above, you're having stage 3. Now, these people has come up with more understanding that, 30 to 60 was classically told to be class 3. In there, they have come, bahut zyada ho gaya, 30 ka number, we'll make it 15 to 15. So 30 to 45 is 3B. and 45 to 60 is 3A. So as you told, persons having a GFR more than 30, in these situations, cyclophosphamide definitely can be given, but with some dose modification. Probably if there is a severity, if there is a lot of activity, and you're having a chance that such a kidney may get damaged, you can think of all those drugs, they can be given, because the kidney failure or kidney problem is not going to stay there for long if lupus is eliminated. If lupus gets treated right on time, this chronicity is not going to progress, and CKD may get curbed, and you just move over classes very fast. Right from 3, you may go to CKD stage 2 also. So, but some drugs, like you have told, tacrolimus is there, that itself is nephrotoxic, that can cause kidney damage. So probably we need to be careful. But all drugs can be given, and they should be given. And treatment will be as per lupus class 3. So we can think of mycophenolate mofetil, we can think of cyclophosphamide also, and in the maintenance therapy, we can think of azathioprine, something like that. We can think of those things. Yeah. So, but we need to go all guns out. The CKD stage should not deter us in the management of lupus, because treatment of the cause is crucial. And if that cause is reversible, just like lupus is a reversible disease, like you're having Vachas in front of you standing, all these 5 years fighting, she's a lupus warrior. So unfortunately, diagnosis on time is important. If it's late, then we are stuck. And if it's late, aggression should be shown by the medical team, I think so. As doctors, we should not be scared that Are kare to kya hota ki. It's better to do it. I think better to overtreat somebody rather than leave it. Yeah, it's
Right,
my personal
doctor.
opinion.
So, doctor, I think we have sort of come to the end. Naveen, is there any other question?
No. Thank you.
I think we're good. All right. Doctor, just to take one question
By
from
the
our
way,
audience.
just one point. In SLE, people reaching the stage of dialysis is just 10%. So that's what the international data tells. And what we are taught is that in Indian population, the people reaching dialysis stage is quite lesser actually. It's not 10, it's quite less. Because I'm working in a hospital where transplants happen at least thrice a week. It's a high volume transplant center. And lupus patients with end stage coming to us is very uncommon. It's not common. But unfortunately, we do see. So probably, I think aggressive management is the key, and lupus can be reversed. There is always hope to it. But if like we are late into the picture, or some very severe disease has come and something has happened, something unfortunately you reach dialysis, which 10% people do reach, then transplant is one of the best options. So once you are a transplant patient, the chance of SL recurring is almost zero. So it does recur. Lupus can happen again, because there is something inherently wrong in that the body, and some training of these neutrophils, immunoglobulins, some guy is corrupted in our body. He's doing all these bullshit things with us. So if something like this is happening, if you're a transplant patient, you're on 3 basic drugs. One is tacrolimus, second is mycophenolate mofetil, and third is a steroid. So this is what is called multi-targeted therapy in lupus class 5 we give, and that's what a transplant patient is on. So I don't think that transplant patient is supposed to have recurrence of lupus. It's quite rare. It can do happen, definitely. Yeah. So lupus patients, it's quite safe to undergo a transplant, I think so.
Right. And I also really want to highlight, so that our viewers remember this, doctor, is the fact that you mentioned, right, a very small 1-digit percentage of patients only really unfortunately end up seeing, you said, I think dialysis. So I think
Yeah, exactly.
because patients usually just hear the word dialysis and then they freak out. No, I'm requesting our viewers to realize the fact that the chances of it happening is so less, and that's what you should be focusing on, and that's the good news.
Correct. That's what happens. See, if you're boarding a flight, the pilot may tell, "Bhai, crash ho sakta hai." Doesn't mean you won't board a flight. That's one of the best, safest journey actually. It's much safer than driving a bike or a car. Flight is the safest. So if crash ho sakta, everyone knows. So similarly, when the doctor tells you about using certain drugs, or tells you about the disease, tells you about your GFR, it is bound on him to tell that you may reach a stage called stage 5 and you may need dialysis. But that shouldn't deter a patient that that's going to happen to me. It happens to very less. 90% of the people do good. So that caution has to come over there. So, but that caution is not what you are made for. So I think lupus patients should look very positive. and don't get deterred by this word dialysis. Even if that stage comes, transplant is the best option for a lupus patient. You have a new life upfront. And once this word dialysis is used and something like this is being discussed, I don't know, our people, they end up going to some sort of alternative therapy and all. I just want to put a point across this because it's a very practical thing with patients and all. So the most educated of people, daughter is a CA, son is a lawyer, and all these very high-end educated people, they end up going to some sort of Siddha, Ayurveda, Unani, homeopathy, acupuncture, all those other pathies, looking for some magic treatment. And just to be very clear, there is no magic here. And so you have to reduce the body's immunity to a certain extent. And you have to be patient. In this disease, I think patience is very important. There is no magic here. It requires patience and perseverance. These both things are the key for a lupus warrior. And probably Vachas is full of all those things.
Thank you, doctor. But so, doctor, one of the last questions, since you only have 3 minutes, and I know you've taken some time off from your busy schedule. The question would be, and I know you were unwell, you had cold, and but yeah, thank you for joining us. But the last question would be with regards to lifestyle. Yes, you didn't mention about salt intake, etc. But what would be some eat a lot of red meat. Now we hear is that some say it's good, some say it's bad. It's so confusing. It's so confusing for a patient with random information lying out there. Could you just tell us about that as well?
Yeah. See, this is what practical is. If you're talking about diet, red meat per se, it's targeted big time because it has a lot of issues with uric acid, issues with cholesterol. It itself has a lot of creatine in that becomes creatinine. So it's not quite recommended, definitely, for all. So what is recommended, we'll just go through the positives rather than discouraging something. So in diet, what we can add in excess is foods which are having antioxidants. What this antioxidant mean is that it's something like WHO. If you are having war in Ukraine, Russia is attacking, WHO, World Health Organization, or UNO, all these things, they can just come and tell stop. As long as we are here, this big organization is here, no more fight is going to happen here. Or something like a fire is there, you may throw some water on it, something. It's not the treatment, but it reduces the severity of the issue. That's what antioxidants does. They reduce the heat of the moment, probably. It's just like a joke when your dad is scolding you, you may crack a joke, mom may crack a joke in between, something like that's what antioxidants are in general. So these antioxidants are quite high. If you're talking about non-veg, they are quite high in fish. Which fish? The patients are very particular nowadays. Fish, bole to kaun sa fish, sir, winter mein milta, so salmon fish, whatever fish. Oily fish is quite good. So salmon is the one, oily fish, smoked fish. These things, they also come in that cod liver oil capsule, 7 Cs. When I was small, used to come. Nowadays, omega-3 capsules are available. So omega-3 fatty acids can be directly taken, or oily fish can be used. If you fry it, the whole purpose is gone. So you're taking a lot of oil in, and it just can damage it. And oily fish also has a lot of vitamin D. So food which is high in vitamin D, eggs can be used. Vitamin D is high in that, and good protein is there in eggs. So it's the most highly soluble protein which egg can provide. So fish, eggs in non-veg. Probably these omega-3 fatty acids are filled in vegetarian foods, and what they tell is flax seed, which is nowadays the trend. Aajkal open ho rahe dry fruit ke shops and all, flax seeds. And since long, India is like full of this Ayurveda business and all. So what happens is you talk about this haldi. Haldi you mix in doodh and drink since a long time. This is also a trend which can reduce the inflammation of the body. And I think these are the things which can be added. Omega-3 fatty acids can be added through fish, eggs, and flaxseed can be taken on a regular basis. And that's all. I think that's fine. That's what we can take. Omega-3 fatty acids capsules also can be taken, and haldi with milk. Nowadays they're even giving capsules of that haldi extracts and all. So probably they are good. They can
Doctor, just to
cause.
highlight, sometimes, while doctors saying all this, I think patients might tend to overdose on these things, hoping that, okay, the more I take, the higher the chances of my nephritis to go is. So I just want to request our viewers that, while this is there, it's all in moderation, right, doctor?
Yeah, moderation depends on, I don't know, depends on many things. But really, I think a teaspoon of seeds per day may be good. And fish बोले तो अब खाली fishy fish पकड़ा है घर में पूरा महला परेशान है may not be a good idea, but something. Definitely, moderation is a very vague term. I think probably 100 grams of fish, and I'm not very sure, but something like that. But this I'm sure. Flaxseed, 1 teaspoon per day can do wonders, and not only for lupus, or it can be any disease, any autoimmune disease, including for COVID. We just passed the COVID era. We have knowledge of n number of these kashayams which we can make at home. Probably everyone is making. So
Yes.
yeah, kada and all those things. So that's fine.
Anyway, doctor, I think we can do extra minutes of your time, but once again, doctor, on behalf of Lupus Trust India, trustees, the patients, the caregivers, and everyone associated with our volunteers, would like to immensely thank you for doing this. And we request you to continue to guide us and continue to do this once again and few more other times. And yes, doctor, thank you very much.
Yeah, sure. Okay, thank you. I hardly could complete few things also because lupus is such an interesting thing. It's multisystemic, but the most important thing is there is light at the end of the tunnel. So probably we should be positive. That's what we have to do.
That's such a wonderful note to end it on. Yeah.